surviving 10 years of living with cancer. And I invite all of those people in that landmark to join me in ringing the bell. You have to get up. You have two choices. You can lie down and give up, or you get up. And if you get up, we're going to fight. Welcome to Jack Ostrov's Hope Podcast. Hold on to positive energy. This is my lovely wife, Shauna.
Hello.
Join us for the podcast. First, we'll start with a little disclaimer. The content shared on the podcast reflects my personal journey and experience as a cancer patient. I'm not a medical professional, and nothing discussed in this podcast should be considered medical advice. Always consult with your doctor or a qualified healthcare professional for guidance related to your healthcare diagnosis or treatment options. Every person's medical situation is unique, and professional medical advice should be sought and tailored to your individual needs.
And everything Jack says applies to me as well. It's just our opinion and our experiences, and we are not giving medical advice or telling people what they should or shouldn't do, just what happened, our experience.
We hope that you can benefit
take that into
from
context. Thank you.
So in our last podcast, we dealt with quite a bit. I had gallbladder sepsis. Somehow I managed to survive that. But barely. As a matter of fact, how many doctors told you I wasn't going to make it?
4.
That's enough doctors. I usually concentrate.
But you proved them wrong once again.
Well, that's because I wasn't listening. I wasn't conscious. Once again, it seems I check out at the right time. I don't listen to the bad stuff. And quite frankly, I don't remember any of it. I've got about a 5-day window where I don't remember anything from getting into TGH to waking up in ICU. It's just entirely blank. And
keep in mind, we were conversant with him. He appeared to be able to answer questions and was very normal. And yet afterwards, he had no recollection. So that's very disconcerting when they're asking you, what are your end of life wishes? And the patient responds and then has no recollection of it later.
Zero recollection of any of it. The last I can recall is pulling into emergency. And after that, it's all a blank. Now, in ICU, started with this crazy event when my right arm started to shake. And that was pretty crazy. At first, I didn't think it was a seizure, but it was a seizure. It was brain cancer. And unfortunately, I ended up with multiple seizures, to the point that the last seizure was so strong that literally my arm went up and then it fell on my chest. Literally could not feel it, could not move it. I thought that was it. I thought I was done for. And
he literally had no use of his entire right arm.
I mean, it's kind of scary when you can't move it and you can't feel it, and you think to yourself, what is the likelihood I'm ever going to be able to get that back?
And then he couldn't feed himself, dress himself, drive. I mean, the implications were quite serious.
And frightening. It's just
terrifying.
It's terrifying. But once I recognized brain cancer, I think, quite frankly, the strategy or the next step was, now we got to dealing with the brain cancer. I eventually got out of ICU in April 2024, and I had to learn how to walk again. Even though it's only been out for about a month, it's remarkable how quickly you forget how to walk. And poor Shauna would walk with me, holding onto my left arm, which was working. I'd be holding my right arm like up to my chest, and we'd walk. We'd do laps. We had that gallbladder procedure that was scheduled for May, but at that point, just coming out of ICU, I wasn't in good enough health to undergo the gallbladder procedure. So they had to monitor me very closely. Not only did I have my arm up to my chest like this, I had another piece of equipment that went into my gallbladder and stuck out sort of almost like a pen type of situation. So
it drained into a bag.
It drained into a bag that I would carry with me. So got my hand like this, carrying the bag, which was attached to my leg, and I'm doing laps. And one morning, they being some gentlemen who show up in a wheelchair, wheel me over to PMH underground, which was quite an experience because it's rather amazing the tunnels that are under there. And we moved to a brain radiation clinic over at PMH. And I met a doctor who said he believed he could deal with the brain cancer. And I was.
Yes, targeted radiation.
And I couldn't believe it.
They make a Zorro mask.
Well,
a full face mask to protect.
But I couldn't believe that it was possible to do some radiation treatment to fully recover from the brain cancer and everything else. And so Sean is exactly right. They scheduled a date, and I got moved over to this unit where you lie down, and they basically put a mask on your face. It's almost like a hockey mask, a goaltender mask. And they asked me if I wanted to keep it, and I'm thinking, this is something that I may not want to have a souvenir of. But off they went, and they left the room, and all of a sudden there's lighting. It's like going to Disneyland or to Universal Studios, and the lights are flashing back and forth. And
it's very precise, and it targets only the tumor.
Well, in this case, they targeted the mass to make sure that it fit me properly and could be a conduit for the radiation treatment, which would happen shortly thereafter. So a couple of days later, he came back to get me again, sat me down, put the mask on. I swear it was no longer than 15 minutes, and the lights are flashing, and they close the door, and I get up, and they said, well, that's it. And I'm thinking, that couldn't possibly have dealt with cancer. I mean, it's like going to a video show. But, oh my God, I mean, the technology is absolutely amazing. The ability, the preciseness by which they could target the radiation, the lesions. I had a lesion on my left side of the brain. And if you can understand this, the left side of the brain controls the right side. Hence, the right side was frozen up like this. I also had a smaller region on my right side, but it hadn't affected my hand yet. And they zapped that as well. And literally a month down the road, we went in for a brain MRI, and they were able to tell me that they were successful. Nevertheless, they had to continue giving me Keppra. Keppra is a non-seizure medication, and one of the side effects is fatigue. So just about all the drugs give you fatigue, not to mention a little bit of brain cancer, a little bit of gallbladder, sepsis, just about everything exhausts you. But remarkably, they were satisfied. This is literally with one treatment that they had dealt with the inflammation, the cancer that was resident in my right lobe and my left lobe. And I just found it difficult to accept. But we continued to stay at TGH, even though I had the treatment. They brought me back there, and I was being evaluated. Was I ready to go to rehab? And so Sean and I would continue our walking. We, still walking with my hand up to my chest, still, dealing with, the fatigue, worried about the gallbladder procedure, which had now been moved to June, and wondering if I would have, if I'd still be a candidate for the surgery. So we were in kind of nowhere land.
And I would like to mention at this point, because he had the cancer spread to the brain, which triggered a seizure, they automatically notify the ministry and your license is suspended. And it's for a minimum of 1 year because they want to make sure that it's safe for you to drive, that you don't have a seizure while driving. So they do suspend your driver's license.
And that's something that I really
impacted.
Yeah. Well, it really impacted my life once I got out. But if you can consider when you're in the midst of just recovering, and your arm is up here, and how am I going to hold the wheel? How am I going to control it? It wasn't the most important thing to me at the time. but I think we all recognize how important freedom of driving is. And unfortunately, I had to wait that full year. My recovery got ahead of this driving, this 1 year mantra. And that's difficult. However, you do get access to Wheel-Trans, which move me here and there. The other thing I want to talk about is the fact that while we're at TGH, we're in a cancer ward. And, it's kind of frightening. I mean, there's a lot of people that are coming in almost daily. I was in a two-room suite, and every day it seemed like I was getting a new partner, and always some very sad stories. Some were successful, some managed to get out, others had sort of dire circumstances. Some with young families, I remember a young woman who was there with her two young children and her husband. And I'm thinking, poor woman. I mean, how sad for her.
Which is why it's important to appreciate and take everything you can from every day, from going for a walk and smelling the fresh cut grass to having your morning coffee, spending time with family and friends, even if it's spending 12 hours putting together an IKEA shelving unit, just take it, enjoy every minute of your day and with your family, because life is very precious.
So during that time period, I recognized my target was to get to rehab. My arm was such that it really was curled up. My hand was suspended. My arm was up here. And I had a visit from good people over at Toronto Rehab, and they gave me some exercises as to how to move my hands and how to sort of keep pulling them, closing my fist, spreading my fingers, doing things that would activate them. Unfortunately, during that time, it was just Shauna and I, and maybe an instruction once in a while. It really didn't make a significant change. But fortunately, in a few weeks, they asked, first they came and asked if we were interested in going to Toronto Rehab, and the answer was yes. I had been there before, approximately 3 years before, and they helped me walk again. I think the world of Toronto Rehab. They have amazing professionals. They got me 3 years prior, to learn how to walk again. This time it was, how am I going to be able to use my arm again? I just couldn't conceive. I couldn't conceive that they could activate this, since it was.
We thought it was going to be permanent because the kid literally was like a dead appendage at his side. So it was remarkable that he's made a 100% recovery.
I was eating with my left hand. I was
trying
to feed myself, trying to turn things on and off with my left hand. I wasn't very good at it, but I knew I had to get a lot better at it. And it wasn't giving me a lot of hope. But here's the lesson I learned. Don't give up hope. Don't. These guys are amazing. The treatments that we have gotten, the service, the quality of people, they are amazing. Their ability, their technical ability, their knowledge is beyond anything I could conceive. And so please, you may be in dire straits. You may feel like this is the end, but don't give up. I mean, the people are so talented. They will explore every opportunity to help you. And the people at Toronto Rehab are amazing. What they were able to do for me was remarkable. And the next thing I'm going to say is, don't roll over. Don't give up. We're not at the end here. We're never at the end. As long as we're breathing, we're fighting. And so, this is not a rollover time. This is a time to get to work. And so I was delighted that I was going back to Toronto Rehab. I want to say something else, because for those of you who don't believe in miracles, perhaps they're only in the Bible. Well, I got news for you. Miracles happen every day at PMH. Miracles happen every day at TGH. Miracles happen every day at Toronto Rehab. They saved my life there once again. PMH saved my brain. One other comment I wanted to make about brain cancer. And for those of you who have had kidney cancer for a number of years, I don't know if there's an exact protocol in terms of the brain. Kidney cancer grows up. So it had gone from my abdomen to my chest, but I never got a brain scan. I had a brain scan probably at the very beginning of my journey, probably in year 1. But after that, nothing at all. And I think it would have been prudent to have done it at least somewhere between year 5 and
But I don't
and
think there's
10.
money in the medical system to do routine brain scans, even though it's very common for kidney cancer for it to spread to the brain.
But because it is common, please consult with your oncologist. Advise, review how long it's been since your brain was last scanned. And I don't think there's any harm in having it. I think it's a good thing. If they had gotten to me earlier, certainly would have been able to prevent, the seizure events, which were just, quite frankly, quite awful. But here's the thing: given that we found this out after I started having these seizures, they were able to remedy it. My scans I've had, subsequent to the brain scan in April of 24, I've had 4 subsequent brain scans every 3 months, and they've all proven to be negative. The cancer was dealt with one 15-minute treatment, which is, to me, just remarkable. Hopefully my brain is still functioning. Sean is probably...
No, but you had a second tumor in the second...
It was treated at the same time, and that's gone as well.
Mm-hmm.
And so I urge you to ask the question and, if possible, get a brain scan. If it confirms you're negative, that's fantastic. If it confirms you have an issue, they have the ability to deal with it. So be proactive. Don't be afraid of asking a discussion the question. It's something that perhaps should be brought up by your oncologist, but sometimes through the course of time, where you've got multiple oncologists, as I have had over the time, maybe it's something that slips through the cracks. Don't be afraid to ask.
I think, because I think a lot of times they don't do a brain scan unless you present with symptoms. So it's not done as a preventative measure. It's done if you present with symptoms. So
I
why
think
not ask?
prevention is worth a pound of cure, as we all know. I encourage you to ask.
Yes.
And don't be shy about asking. Ask lots of questions about everything that concerns you. But the miracle happened. I got out. I got to TGH. I was there in the beginning of June of 2024. My arm like this. I'd be walking around and I'm thinking, oh God, I don't know what they're going to be able to do for me. I mean, they're great, but I couldn't feel optimistic because this sounded like insurmountable. All the work that I had done for 3 weeks at TGH in terms of moving my digits and trying to sort of move my arm, move it up and down, it just was not yielding results. But off I went, and that brings us to our next podcast. At the moment, before we leave, I want to remind you that, I've been blessed by all the services that have been offered through PMH, TGH, services I get through Ontario Cancer Foundation, Kidney Cancer
Canada.
I encourage you to click on a link, donate. This is for yourself. This is for your family. This is for your friends, for your community. Please donate. Research is what's going to save us all here.
Mm-hmm.
So it's very important. Please contribute. It saved me. I hope it saves many others. I know it does. And I wish you the best in your journey. Please tune in for our next segment, which will deal with my 3-week stay at TGH. At Toronto Rehab. Please join us soon. Thank you very much.
Thank you. Take care. Have a good day.